Hi, I'm Dr. Ashwin Rajagopal. I'm the consultant surgical oncologist at Manipal Hospitals Whitefield. It is not known why some people get cancer and why some people don't. But there are a few genetic cancers such as ovarian cancer and breast cancer, where the children can inherit it from their family. The risk is about 10 to 15%. But the exact cause of cancer is very complex. It depends on number of factors. The first one is dependent on the age. It's dependent on the immune condition of the person. Third one is the lifestyle changes such as smoking, alcohol, then exposure to sun, unsafe sex practices. Then and most important is the genetic factors, which we are getting more and more aware of. Unfortunately, there is no one single test where cancer can be detected. Because there are over 200 different types of cancers, there are multiple tests which are available. A few tests are blood tests, which is called as tumor markers, where we can detect a few cancers such as colon cancer or ovarian cancer. A few tests which is radiological, that is mammography, which is nothing but a simple X-ray of the breast, a CT scan and an MRI scan. There are also other few tests such as an endoscopic biopsy, a colonoscopic biopsy or core biopsy. All these tests are simple and which can be easily be done, and all these tests give us oncologists information about detecting cancer and also diagnosing what type of cancer you have. This is one of the biggest myths that is prevalent right now. But as an oncologist, I can assure you that this is absolutely wrong. Research shows that doing a small biopsy does not cause any spread of cancer. In fact, biopsy is absolutely necessary. We need to find out what type of tumor that we have. There are two types of tumors. One is called as a benign tumor and other one is called as a malignant tumor. Based on biopsy, we can decide the type of treatment that is required. There are different kinds of biopsies. A few are endoscopic biopsies, a few which can be done with radiological imaging, and few which is called as an open biopsy. But all these biopsies are painless, which can be done on OPD basis within a matter of about 5 to 10 minutes. There are a lot of patients who, when I tell them that they need to undergo a biopsy, but they get scared and they go to some other doctor thinking that biopsy causes spread, but this is absolutely untrue. All of them consider cancer as a death sentence, but this is not true. Most cancers are cured, but the cure depends on the type of cancer and also the stage of cancer. Early stage cancers are absolutely curable. That's the reason screening of any person for cancer is important. At Manipal Hospital Whitefield, we have multiple types of tests that a patient can undergo, such as CT scan, an MRI, a blood test, where cancer screening can be done and they can be detected early. In fact, with better research, we have found that even advanced cancer, that is stage 4 cancers, can be cured with help of chemotherapy and surgery. This is one of the most common myths which is associated with cancer treatment, which is not true. There are different types of treatments for cancer. First is surgery, second is chemotherapy, and third is radiation therapy. People consider all these type of treatments to be worse than cancer, which is not true. When I tell any person they need to undergo surgery, they take it in a negative way. But I can assure you that with better forms of treatment, now it is in fact shown that for breast cancer, it is not necessary to remove the entire breast. If the patient comes early, we can save the breast. We can perform what is called as breast conservation surgery, where the women can no need to undergo the removal of the breast. Everybody thought surgery is mutilating, which is not true. Now with better treatment options, now we can do surgery where we can admit the patient in the morning and we can discharge the patient in the evening. With the advent of robotic surgery and minimally invasive surgery, the patients can be treated with small cuts, with less pain and faster recovery. Most of my patients who come with early stage cancer can get back to work within a span of 1 week.